are presenting on the call, and we are recording. So we're going to go ahead. And so I'm Sally Lampron. I'm the Research and Evaluation Manager here at Fair Chance, and I will be one of the presenters and facilitators today. I'm going to pass it to Anne.
Good morning, everyone. I'm Ann Miles, and I am the Chief Program Officer at Fair Chance. I'll be presenting alongside Sally. I will pass it to Salome.
Good morning, everyone. My name is Salome Odera. I'm the Communications and External Relations Manager at Fair Chance. I'm running behind the scenes tech today.
Thank you, Salome. Gretchen, I don't know if you want to introduce yourself or I can.
Good morning, everyone. I'm Gretchen Vanderveer, and my primary role today is just to be available for any questions and to be observing and just part of the discussion.
Thanks, Gretchen. And then Regine, if you'd like to come off and introduce yourself.
Hi, my name is Regine Ellie. I'm the Executive Director with Healthy Babies Project and a Fair Chance alumni.
Thank you. So again, as folks, as you come into the room, if you'd like to put your name and your organization and your position in the chat for us, it's great to see everyone hopping on. So we're going to go through some quick tech housekeeping as people keep joining us. So we are recording today. Oh, sorry, guys. And so we will be having everyone on mute. If we hear some background noise, if people come off, we will be putting people back on. Please let me know if you can't see me or hear me at any point. Salome will help us keep track of that too. If you have any issues that aren't seeing or hearing, you can contact Salome. She has changed the tech space where she has the chat open to Fair Chance Tech, FC Tech. So you can message that if you are still in Zoom. If not, you can email Salome at sodera@fairchance.org. She is the one who is sending the reminders, so you can email that back. If you have questions, you can please put them in chat at any time. You can also use the raise hand feature. And again, Salome will be helping us keep track of that. And then again, we are recording and we will make that available to people after we register. So we are here today to talk about Fair Chance's external evaluation. We're excited to welcome you all to this opportunity to learn more about Fair Chance's evaluation of its Praxis program. And we're going to discuss how this adds to our understanding of capacity building for small nonprofits. Our agenda today is to give you a quick overview of Fair Chance, explore what we've learned through our evaluation, what that means for our future work, and then we'll have some discussion around implications for the sector. So at this time, I'm going to go ahead and turn it over to Anne to do the introduction and overview to Fair Chance.
Thank you, Sally. So as most of you know, Fair Chance has been around for 20 years, and we've been building the capacity of small community-based nonprofits and their leaders to deliver better outcomes for children, youth, and families living in high poverty neighborhoods. Our work is deeply rooted in the fact that structural racism has contributed to the under-resourcing of communities of color. You can go to the next slide, Salome. We focus specifically on small community-based nonprofits for a reason. We believe that these organizations are in the best position to transform the lives of children, youth, and families, specifically because these organizations are embedded in communities where they work. They're serving neighborhoods where racial inequities and systemic barriers exist. They're led by people whose identities and experiences reflect the communities they serve. They have the trust of the residents, and they're therefore critical players in fighting for equity and creating sustainable change. Unfortunately, because these small nonprofits, who the ones we work with, tend to have an average budget of around the size of $500,000, You know, they have a full-time executive director typically. Maybe they've got some program staff part-time, maybe full-time, but they really don't have development staff. They're strapped for resources. The ED is embedded and involved in a lot of areas of the organization. So they lack the finances to afford capacity building services that could help them deepen their impact. And so this is one of the reasons why we offer capacity building free of charge. Less resources, as I just mentioned, isn't just about money. Since the ED is often wearing many hats and deeply engaged in delivering programming, grant writing, and other things that larger organizations may have dedicated staff to do, this requires capacity building for small nonprofits to be creative and flexible, and therefore must build upon the strengths of the organization and the ED. You can go to the next slide. So our partnership model, our founding story, if you would say, Fair Chance was founded because of issues that our founder, who had been a funder, saw with the funder-driven capacity building model. She believed that there were ways to work with organizations who were left out of capacity building. And so our model was intentionally designed to mitigate some of the issues found in the funder-driven model. We focus on strengths and assets versus deficits. We try to mitigate power imbalances by being no cost and by developing a trust through a relationship between a capacity building specialist who has lived experience in nonprofit leadership, pairing that capacity building specialist with an executive director and developing a really deep one-on-one relationship that is based in trust. Our programs are intensive and long-term. They're not one-off. The Praxis program, which we're talking about today, is 12 months. It requires weekly meetings between the capacity building specialist and the ED, and it's guided by a customized work plan. That work plan is based on a pre-assessment. Through that assessment, we strive to meet the ED and the nonprofit where they are. So we create a highly customizable work plan. It's not cookie cutter. It really is dependent upon that specific nonprofit and that ED. And the work or the way in which the ED wants to grow their organization. The work plan is not rigid at all. We flex and adapt it to respond to sort of unforeseen needs as they come up during the program cycle. And then at the end of the partnership, the ED completes a post-assessment, and that helps us to measure progress made during the partnership.
Thank you, Anne. Yeah, at this time, I'd like to invite Regine, who, as she said, is a former Fair Chance partner. She was part of our 2015 graduating class. She also participated in the evaluation as a member of our alumni advisory group. We just wanted to invite her to share a bit about what was so powerful for her and what she continues to benefit from these partnerships.
I always love the opportunity to talk for Fair Chance, and just a little bit about Healthy Babies. Healthy Babies project has been around since 1990, and our primary this is like the really short version, is to assist young parents to ensure that babies are born healthy, have a safe place to lay their heads, access to healthy food, holistic living, modalities, and more. But I want to talk specifically about Fair Chance, and Fair Chance really assisted Healthy Babies, and I think all of the non-profits, to look at what the vision and mission is beyond the clouds. And in order to build or expand or strengthen that vision or mission, you need people that are able to work with you in this process that I'm going to call emergent solutions, right? They're able to take this collective imaging narrative and break it down into steps, for the non-for-profits. And we wouldn't be able to have those steps oftentimes without Fair Chance. The community building specialists, they create a calendar, or for some people, it's like a timeline, and you're able to flip through that calendar forward. So for Healthy Babies, as we get ready to build up the transitional house to build a second level, Fair Chance was very instrumental in bringing, whether it was funders to outdoors, in bringing and breaking down the steps that we needed to take. It's being able to be together, grounded in community solutions and being an architect of that collaborative solutions to build and to expand. And this is what Fair Chance has done for us. So in 2023, we've got the architectural firm, and we're moving, even with Christine's help, just understanding the process of navigating through the earmark process. You were definitely the champion for that. And we're really, really just very thankful to Fair Chance. That's what community building, community capacity specialists have done, for us. And we're really thankful for that. And I turn it back to you, Sally.
Thank you so much, Regine. I think you hit on a lot of ways that we continue. We really look to work with the individual and unique visions of our organizations. And we really believe in this continued support that we're able to provide through our network services with Kristen. Thank you so much. So talk a bit about this evaluation. So we decided that now was the right time to do an external evaluation of our Praxis program because we had heard anecdotally that our partnerships are very powerful. We had put in place an evaluation plan with a assessment that we had developed in partnership with Shattuck and Associates, and we had been using that for more than 5 years. So we had more than 5 years and more than 5 cohorts of pre-post assessment data, and we had more than one cohort that had given us data on their organizational metrics, like their revenue, their number served, those sorts of things, for 5 years post partnership. And so we'd really developed the pool of data that we needed to be able to look at this. And we're really looking to have a proof of concept that our approach, this different look at how to capacity build specifically with smaller nonprofits, that it was really something that worked and that we could take on the road. And from an equity standpoint, we had started an equity journey, and we knew that there were areas where we were being really effective in supporting an equity space. But we also knew there were ways that we needed to grow more deeply on our equity, and we wanted to be able to talk to our nonprofit alumni about what that looks like. So through a process, we selected SPR, Social Policy Research Associates out of Oakland, California, to join us on this journey. They helped us develop a mixed methods approach to evaluate the program. It was culturally responsive. They use a culturally responsive framework. And one of the big ways that came up, one of the things that looked like was that we had our alumni advisory group. So Regine and 2 other alumni executive directors joined us for the duration of the evaluation, meeting with us and SPR through several meeting-making meetings throughout the process, so that we were checking in on the data at every point and able to give our feedback, both as staff and as alumni. SPR also did a validation test on our assessment tool. They assessed our outcomes, starting with data collection from 2013. They interviewed 3 capacity building specialists, we call them CBSs, capacity building specialists, and 15 partners. And then they did a comparison study with propensity score matching for the revenue and multiple regressions for the youth served. So it was pretty robust and exciting. So some of our key findings were that nonprofit revenue grew by nearly $1 million over that 5-year time span. In addition, alumni participants' revenue was 176% higher on average than a control group of similar organizations over time. And so that is at that 5-year mark. 5 years after a partnership, our participants had 176% higher revenue than a control group over that similar time. So it's pretty exciting. The majority of our nonprofits increased in the number of children they were able to serve, children, youth, and families they served, by an average of 106%. During the partnership, 90% of alumni participants grew in their capacity to implement common practices, common nonprofit practices, in at least 4 of 8 capacity building areas, which is our goal. The 4 is what we focus on in partnership. And executive directors reported increases in knowledge, confidence, and skills across the board, all 8 capacity building areas. And that resulted in strengthened leadership that really believed in their ability to catalyze their organizational growth. which I think Regine sort of illustrated, talking about that vision and that plan to move forward. It's really impactful. So that's some lovely data, but what does it really mean? So when we really set back with those findings, what did we really learn? We're really encouraged by these outcomes findings, but when triangulating the data with the interview information as well, we learned that a couple of key pieces of our approach are really impactful and critical to our success. So you go ahead and hit the slide. Thank you. So the first is that the capacity building specialist expertise that they bring to the partnership are really critical for participant growth and for trust building. So that expertise is not, it's not like financial management expertise explicitly, or how to build your board explicitly. The expertise that the capacity building specialists are bringing that's so impactful is that we draw our CBSs from the community. So they were leaders of small nonprofits in the cities in which they were working, and mostly in DC at this point. And with that, they understand what it means to be an executive director of a small nonprofit. They understand the local context, what it means to work in DC and who you need to work with. They know who those players are in the foundation world and government, and are really able to help their executive directors move in that space, and to have someone who can provide practical and emotional support for them in their space as an executive director. And that creates a level of trust that helps this exponential growth. It fosters a very powerful sense of trust and engagement because they're able to connect with that unique context and it's familiar to them. And the alumni partners also really appreciated that created a deep investment for the capacity building specialist and the organization's success, not just the executive directors, but also the organization. Participants shared that they discussed tools and resources that they developed while they were in partnership, which they were able to use after the partnership to really continue to springboard and advance their organization. And I think what's important here is that we develop these tools with our executive directors. We're not pulling things off of the shelf and just handing it to them. It's really a process where we are understanding the organization's strengths and needs related to their unique context and helping them develop tools that are going to work for them. So we spend a lot of time, 12 months, working with our organizations to do that. And it seems to really make a difference. The assessment and the work plan, as Anne has talked about, are used to identify those areas that we need to work in and develop those tools. The process for the assessment, for the pre-assessment, is that the executive director and the CBS sit together and go through the item line by line. And they are able to develop a large sense of trust doing that. The assessment was also found to be statistically reliable and valid, which is great. And another important, and the reason that's so impactful is that we did develop this with input from small nonprofit leaders. When we developed this assessment, our capacity building specialists were all had that lived experience as executive directors, and so they were able to bring that lens. And they were also working directly with executive directors at the time, and so they were able to bring in all of that feedback into the development of our assessment. So it is a proprietary assessment, and we did that with input from small nonprofit leaders. Sorry, just checking the chat really quick. Excellent. And then we also found that the resources for our alumni were helpful and supportive. So over time, we've been growing this body of network services, and we learned through this evaluation that those are really pretty critical in our organization's success, our alumni success. That continued support allows the executive directors to learn from each other and helps to continue to mitigate that feeling of isolation that executive directors can sometimes have, and the role can be, I've heard many people say the role can be very lonely. And so that continued network helps to support executive directors through that feeling of isolation occasionally. And then they feel as if they have a community and a network to help them elevate their organizations. So they really are able to continue to pull on their capacity building specialists and our team of capacity building specialists here at Fair Chance, and others in their network to help them continue to move up and forward. So I'm going to pause there, see if people have any questions about our findings. I'm not seeing hands raised or anything coming up in chat. How difficult is it to find and keep capacity building specialists? And what is the average tenure? Anne, do you want to speak to that?
The average tenure, it is challenging to find capacity building specialists. Because our work is very intensive, one of the things that we have done is to build out and train. We sort of have a way of training folks in our method. We have had to rely on using consultants for some of our capacity building work. Our work in Prince George's County is all consultant based. In DC, we are more, it's split a little bit, but it is, we're more in staff member based in terms of our capacity building role. Honestly, one of the challenges is the salary that we're able to offer. And so we're finding that folks who have the expertise often have their own consulting practices. And so they are not necessarily looking for full-time work, but they are looking to supplement their consulting practice. We're attractive to them because we can give them a contract over a long period of time. You know, as we've mentioned earlier, our capacity building partnerships are intensive and happen over a long period of time. So we're able to give consultants year-long contracts. There are folks out there who have the skills to do the work, but as I said, we're finding issues with the salary.
Gretchen lifts up that we do have capacity building specialists who have been with us for 7 to 10 years and have moved into different roles in the organization, but are still able to bring that.
Yes.
And I'm still in touch with my capacity building specialist till this day. Still offers some solutions, will send me a text, will, introduce me to different opportunities. So there's a relationship formed that continues.
Mm-hmm.
Thank you, Regine. I think at this point, do one more question about the time commitment and expectations for a capacity building specialist and the ED. I can talk to that a bit if you like. Yeah, so during our partnerships, the Praxis partnership is 12 months, but we use the same cadence in all of our partnership programs. The CBS and the executive director are both expected to spend about 8 hours a week on partnership work. And 2 of those hours are together in a meeting. So there's a weekly meeting and it's best frame. We set it up at the beginning of the year and it continues on as some sacred time to work together. And then both individuals are doing work outside of the meeting to help continue to move the work plan forward. So both the executive director and the CBS are expected to do 6 additional hours of work. And Patty, I see that second piece about the curious funding streams for paying CBSs. I think we'll put a pin in that and come back to it during our larger discussion time. So Anne, I'll go ahead and pass it over to you.
Yeah, thank you. All right. So what do the findings mean for our future work? I think just kind of picking up on where Sally left off and some of the questions that we just responded to. We really need to explore ways to continue to connect organizations within our network to one another. Peer-to-peer learning is very important, and as well as we've heard that the relationship between the executive director and their capacity building specialist is important, therefore their relationship with Fair Chance. So we are working to build out offerings for our alumni so that they have access, continued access to capacity building supports beyond a partnership program. We are creating offerings in our network services program that does that. And we want to do that really to in a way that replicates the work in partnership, that relational approach, meeting people where they are, being responsive to the needs of small community-based nonprofits. I think our relationship really is one of the strongest things that we have when we're doing capacity building work. We also see that we can do some work around redesigning our outcomes and exploring new ways of measuring success, right? We're going to be looking at considering additional intermediate outcomes in addition to how much money is raised or how many kids are served. But one of the things that we've learned is that our partners measure success in additional ways, and we believe that we can incorporate ways in which they measure success into ways in which we measure success. So we want to partner with them, we want to hear from them, and we want to develop together how we define success. We also know that we can do more in advocacy. We're going to invest in our ability to serve as a champion and be a leader, take a stand in ways that we can to address issues of equity in DC and in the region. So we want to sort of stand side by side with our partners and really use our platform and the microphone that we have to support things that are important to them. We're going to be examining some of our practice areas, our capacity building areas, and intentionally focus on strengthening nonprofit resiliency. We see that we could center equity in our work more, and so that's a journey that we're going to continue to take. We believe that we can prepare nonprofits for future challenges and amplify their individual and combined impact in some new ways. And one of the things that we specifically want to focus on is closing the 25% disparity in revenue raised between leaders of color and white leaders as well. So there may be some ways in which we focus on fundraising and creating, being a bridge and creating relationships between funders and nonprofits that can help support this. So I'll pause there to see if there are any questions. Okay, I'll go to the next slide then. So just to wrap up and then to open it up for general discussion, we believe that the needs of small community-based nonprofits are different than larger nonprofits. We address the reality of small nonprofits through our partnership approach that really is the one rooted in relationship between the one-on-one relationship between a capacity building specialist and the ED. That approach and that relationship values and underlines and speaks most to power dynamics. It is a relationship of trust. It is a place where each person, the ED and the CBS, can show up with their expertise. They can learn from one another and can share learning across the community. We meet people where they are. Our work is customized with the resources that are unique to the EDs in their organizations. We really work on building their strengths. And then our assessment helps us learn where they are. So there's a lot of deep learning and reflection that is done in partnership. And then we're getting to organizational systems that allow EDs to really focus on being thought leaders versus being the boots on the ground delivering the programs. But we are working to get them and their organizations to a place where they have the systems where they can be those thought leaders, where they can be advocates, where they can be strategic thinkers, sort of versus being stuck in the weeds of the day-to-day of a nonprofit organization. We've realized that there's a need for continuing support. So we are very excited to kind of focus on and build out our alumni services through our network services programming to find new ways to have peer-to-peer sharing and learning happen, and to continue the support of our alumni nonprofits over their life cycle. It's important to continue to support them as they continue to grow, and not just think of capacity building or think of our partnership programs as a one and done solution. We believe the evaluation backs up the effectiveness of this approach, and that we are going to continue to work towards equity in our approaches and our actions. So that's sort of it for our presentation part of this discussion. We wanted to open it up to any additional questions that you all may have, or sort of ask you, how does what we share sort of fit with your understanding or experience or view of capacity building with small community-based nonprofits? And we'd love to hear sort of what you're learning.
Hey, Jeff, I see your question here. What are the 8 areas? How do we measure and how are they selected? And Rick, I see your hand. Our 8 areas are board development, fundraising, financial management, leadership and management, program evaluation, outreach and communications. I see Bimini typing. I hope she's typing them in for me. Are you? Thank you. Planning and strategy and human resources. Yes, thank you, Kristen. It's pop quiz. You would think when I look at assessments all the time, I'd have them memorized. So they are measured through this pre-post assessment. So at the beginning of the partnership, the executive director and the capacity building specialist work through over 130 items spread out across those 8 areas. And they go through every one and all 8 areas. And then based on, there's also a battery of follow-up questions during the pre-assessment that really helps the CBS get deep in their understanding of what's happening for the nonprofit. And so using all of that information, the capacity building specialist will develop the work plan, which lifts out those 4 areas that they're going to focus in the most. And then that is reviewed by the executive director. The executive director has a chance to weigh in and see if there are things that don't quite line up for them. And that is how we get to a final work plan. So it is not just data, it's not just quantitative data that drives those areas. It's really getting to understand the full breadth of the organization, their full context. No problem, Jeff. I should have those memorized. Thank you, Bimini. Yeah, Rick, what's your question?
Well, first off, I just wanted to say thank you. This is an evaluation kind of at a level of rigor and thoughtfulness that I think is uncommon in capacity building organizations, and I really appreciate it, and also appreciate the opportunity to come together and talk about it. I took 2 notes early on. I noted the 176% revenue increase, and I noted the 106% increase in numbers served. And I think those are impressive and exciting numbers to talk about. but I'm wondering if you could clarify kind of over what time period that happened. And sorry if I missed that. And also, I'm assuming that this was against their own baseline, like this is kind of from where they started over a certain period of time. And I'm wondering if you have comparative data, like I know you had a control group, and I wonder like how that compares to the control group.
Sure.
Sorry,
So,
that was a complicated question. Thank you.
Oh, it's okay. I think I've got it all. So the 176% increase in revenue is from the comparison study. So that is compared to a group of similar nonprofits. And that was over 5 years. So that was at the 5 years post-partnership for our alumni, and comparing that to similar organizations also tracking their financial data over 5 years, over that same 5-year period. So through propensity matching. So that's a very exciting finding. It's really quite astounding. It's really amazing. For the 106% increase for children and youth served, that is compared to their own baseline. So that's what we're seeing. It's measuring the number of participants served is an interesting nut to crack, because every organization has a different program. And so we have programs that go really deep in working with individuals, and so their numbers are smaller. We have organizations with bigger outreach goals, and so they have bigger numbers. And the way that their programs evolve over time, it just doesn't necessarily show the impact in the number over time the same way revenue can, because you can use those dollars in a lot of different ways and still do really impactful things. So the 106% is the base, our alumni and their comparison to their own baseline only.
Rick, they did a comparison, this is Gretchen, they did a comparison on numbers served as well. And while there was a small difference between the control group and the fair chance sample, it wasn't statistically significant, where the revenue one was statistically significant. So we're using, in this case, just the pre and post on the fair chance sample in our data presentation.
Thank you, Gretchen. Any other questions? Any other thoughts about how this fits into our current conversations in the capacity building field?
One of the things that I thought was a really interesting finding of the study was in looking at the there were 41, is that right? 41 fair chance EDs partners in the fair chance sample. And they looked at the revenue growth for the white leaders versus the Black leaders in the sample. And while there was growth and increase in revenue for both groups, the white group was a larger growth than the Black group. So what that tells us is that even controlling, even having it the same program, the philanthropic bias is still there, even though, it's not a skill issue, it's a philanthropic bias issue. And so what that has, our takeaway from that is that our systemic work around really trying to do things to challenge the sector around issues of bias in philanthropic work is something that we need to advance when we can and as we can. I just would love to know others' thoughts on that finding.
Thank you, Gretchen. Patty, please.
Thanks. I just wanted to say that I can't remember who was talking, but at the beginning when you were talking about who you serve and the reality for executive directors and small nonprofits, like I just wanted to say everything you said I resonated with, both from my work as a consultant, a senior consultant with Maryland nonprofits and those organizations we serve, But actually for the previous 25 years to coming on to Maryland nonprofit staff, I myself was one of those nonprofit leaders in West Baltimore and Sandtown. And the reality you were speaking is like exactly where so many nonprofits are. And it's just encouraging to hear the focus that you have, and really was intrigued like with the terminology at the beginning, sort of the funder-based capacity building, as opposed to other, or I forget what the terminology was. And I think that one of the issues for capacity building actually is philanthropy, right? And how do we help move philanthropy to understand some of how this capacity building has a different framework or a different lens when it's funder based versus it being based in the nonprofit or in the community itself. So I just wanted to say thank you. I felt a resonation for myself, resonating with you all. Thank you.
Thank you so much for sharing. I think that is an excellent question about the difference between the funder and not funder driven capacity building and what that really means for the philanthropic sector. Gretchen, I see you came off again.
I'm just wondering if we might spend some time together thinking about how we could raise this issue more in the sector. I think these learnings have profound implications for that. Thank you, Patty, for your endorsement or affirmation of that. But what are some ways that we might be able to bring these learnings more to the sector and have this kind of conversation in a larger way?
So I'll offer one thing, I think, and different folks who are on this call may be doing different things in this way, but one is the education of the funders, the education of the philanthropy folks who are giving the money, and in the conversations with them as we are putting forth proposals or as we are partnering with them on cohort, especially engagements like cohort capacity building types of experiences. I think that we ourselves who are in this sector can begin to make that change. It might be incremental, but helping them to understand. So for instance, what's the importance of having stipends or something that helps to support those who are giving their time so much, right? And I don't believe that the funders automatically put that in, and they may like not look very well upon it. But I think if enough of us begin with the groundswell of saying that's part of the reality, and I think that having funders hear the reality of what is happening with those that we're serving. A lot of times if you have a funder in the room, the participants or the folks who are a part of the cohort don't speak as freely and don't feel like they can speak as freely. And so how can we help the funder to hear what the funder needs to hear so that they realize or can come to realize that a lot of times nonprofits just do what they have to do. We just jump through the hoops we have to because we want the money and we need the money. So we kind of take it as just one of those things you have to do. And we don't actually think that we can make a change. But I think that we can make a change, and it's a part of educating those funders. And the more voices, the better, right? So if we all do it and we're collectively doing it, I think we can make the change with those funders.
Definitely. I will say that Fair Chance is somebody that puts their hands in the work that they do. And because of that, they, Gretchen, brought a group to Healthy Babies and they took a tour, and they were able to talk to the consumers. And that opened up an opportunity for us for funding with a foundation that you have to be invited in. So had that not happened, that foundation would have not known about the good work that is happening here. And it was by, rolling up the sleeves and really being able to put their hands on the pulse. And that's what the difference is with the CBSs. They put their hands on the pulse, they communicate, and Gretchen took that opportunity, and not just with Healthy Babies, but with all of the different non-for-profits that are, partners, the alumni, all of them. And they, they really are invested in what they do, because at the end of the day, it's, it's a vision about one humanity. And that is it. I get emotional when I talk.
Thank you, Rasheen.
Thank you, Rasheen.
Oh, Kristen, I see your hand.
Yeah, well, there've been so many articles recently about capacity building and challenging the paradigms that I think was mentioned when we started. And one of the things around that is debunking the myth that capacity building is kind of a one and done thing. You need it, you do it for a year or however long, and then the group should be good to go. And I think that's definitely something that we're seeing, especially with the pandemic, that there is really a need to continue to make capacity building available. And one thing I just wanted to share from my experience, I was a capacity builder doing the long-term partnerships for 6 or 7 years with Fair Chance before I shifted over to working with the alumni. And that is, working with a capacity builder is a skill that you develop. And I would be curious, I don't think we know really where that 170, why that 176 is happening, other than, we do good work, but I'd be interested to know more about why that difference exists with our comparison group. And I have a anecdotal experience that a lot of the partners go on to do other capacity building with other groups. And I think that it's important for us to recognize and maybe explore what is the role of actually learning how to work with a Taproot group or a Compass group or some other group that may not have the same kind of hands-on approach that we have, but to be able to get the value out of that experience and to continue doing capacity building.
Thank you, Kristen. Yeah, I think there's some conversation in the sector too about how people who do capacity building do more capacity building, and it supports them. I think that is a growing line of questioning and research in the field, and that's a really excellent point. Thank you.
And we certainly recognize that we're not the only ones who are doing capacity building in this region, and that there are ways for us as a capacity building organization to partner with and strengthen that network that capacity building organizations have. We have certain skill sets and superpowers, and other capacity building organizations have their own skill sets and superpowers, and we should really be relying on the strengths of them as well as the strengths of our nonprofits. Any other thoughts or questions?
Thank you, Patty. Yeah, we're happy to share. I think I can see everyone.
Might be interesting to talk a little bit about the diversification of the groups that we work with over time, because we used to only have one program, which we now call Praxis, and now we have Pathways and Ready for Work, and we had Impact Academy. So that might be just interesting to give some context to the Praxis evaluation as where it fits, because we've been challenged to work with smaller nonprofits and reduce barriers, and as well as working with more advanced organizations. So I don't know if Anne or Sally or someone wants to speak to that.
You could speak to that, Kristen. You've been in the field, so you know some of those barriers.
Okay, yeah, so some of the barriers that we've addressed are, we have a pretty intensive application process, and we have changed it over time. And so that it's a less of a burden and more accessible to organizations who come more from an oral tradition than a written tradition. It's we try to make it very much a relationship building process. Another thing so our Pathways program works we assess in 4 areas and work in 2 areas, and it's an 8-month program that's more cohort based. We have a process, a leadership circle using the Brene Brown Dare to Lead. And so Pathways is very much tailored to smaller organizations. Ready for Work, which Valerie leads, is a 3-year capacity building program in partnership with Venture Philanthropy Partners. And that is focused on building nonprofits in Prince George's County, which are, there haven't been as many resources for Prince George's County nonprofits. So I think it's something like, somebody can tell me the exact numbers, but it's something like the average revenue is $25,000, and there are hundreds of nonprofits. A lot of them.
I was going to say, Patty probably has the most accurate number. It used to be like close to 90% had revenue of $25,000 or less. I think it's gone down slightly to maybe somewhere in the 80s, but yes.
So that's been a whole different approach of having a 3-year model, and that's a much longer relationship. And then Impact Academy, which we have on pause right now, was to evaluate and see how we can further develop it. We did a pilot in 2016 to 2018. We worked with 3 groups and helped them to learn better how to measure their impact and tell their story using data. And that was very successful. We just haven't had the money to relook at it and relaunch it. But so there's just a broadening spectrum of groups that we are trying to support. And even within Praxis and Pathways, we're seeing wide ranges of what the groups are ready for.
So for the evaluation, for the organizations that were a part of the evaluation, the majority of them were before we started having these separate programs. That sort of happened kind of in the middle. So it was around 2018 where we really started explicitly separating out our programs. And so a lot of the organizations were a good mix of people who might be in Praxis or Pathways now, but we're in our one partnership program then. And so just for the data, I just want to make sure we're understanding what we're looking at. Thank you, Kristen. We are coming up on time. We've got about 2 minutes left. Are there any final thoughts or questions? Patty shared that the Maryland Nonprofit Standards of Excellence is also available on a national level. So if that's of interest to anyone, elevate that. Thanks, Rick. Thank you so much for coming. I want to thank, I neglected to acknowledge earlier that there are a number of Fair Chance people in the room, and thank you so much for adding your knowledge and your interest and your excitement to this conversation. So Kristen, Bimene, Gretchen, of course we introduced, and Val, thank you so much for being here, and Tamala, and supporting us.
I just want to say thank you to Sally and to Anne for putting this together, and also to Salome for providing the technical support. This was great, and I'm glad it's recorded. Everybody have a great day and a great weekend.
Thank you, everyone. Thank you for showing up and for your interest in our work and our evaluation.
Yes, Patty, we'll send the presentation recording to those who were registered.
Yes.
Yeah. Yes, bye, Patty. Thank you so much.